also interacted with a child who had psychopathic tendencies. So even children, it usually starts when they are a child. When you call an adult a psychopath, it means that it has started in their childhood and it wasn't identified. So the child was a 7-year-old. So what the boy had done, alikuwa amechukua kiti, then hit the other child with a seat. So even the other child had been hospitalized because of that.
In Session with Jael, Keya, the space where healing hearts connect. Hello and welcome to In Session podcast with Jael, Keya. In today's episode, we step into one of the most sensitive and urgent conversations of our time, the mental health of our children. We often ask what is wrong with this child, but rarely do we pause and ask what happened to them, as Oprah Winfrey told us in her book. Behind every tantrum, withdrawal, or sudden silence is a story. And today we're joined by a child psychologist whose work uncovers these stories with tenderness and truth. From the heartbreaking account of a young boy misjudged and misunderstood to the complex journey of diagnosing conditions like ADHD, we explore the painful gap between awareness and action. We talk about the fear and the stigma that parents often face, the challenges of navigating a system that is not built for neurodiverse children, and the lifelong impacts of unacknowledged childhood trauma. But we don't stop at the pain. Heck, we're not all doomed here. We journey into hope. You'll learn how anxiety and depression show up in children in ways we might overlook, and the red flags that we often dismiss as normal, and why mothers, fathers, caregivers, educators must become emotional detectives for the little hearts in their care. So whether you're a parent, a teacher, a health worker, or simply a human being who cares about the next generation, this episode will open your eyes and stretch your heart. So lean in and let's get in session and talk about what it means to really see our children and how we can offer them healing, safety, and understanding. For the sake of our audience, introduce yourself, tell us who you are and what you do.
My name is Lewis Karanja Wainaina, child psychologist, HTS counselor. I'm also a palliative care specialist and co-founder of Vuuka mental health consultancy.
I didn't know you're a palliative care specialist as well.
Yes, I did palliative care at Nairobi Hospice. So I've been seeing clients with terminal illness and just guiding them in terms of counseling, in terms of care. Yes, basically helping their extended family in terms of grief. Really, that's what it entails.
Interesting. I think we'll have you back to have a conversation on that. But on this episode, we are going to talk about children and their mental health. But before we do that, what does our audience need to know about Lewis that defines who you are? Apart from all the titles, all the things that you have said, what's your story?
Lewis is a firstborn in a family of 3 siblings. I am a go-getter, so whatever I put into mind, I usually make sure that I've been able to accomplish. I love good food. Now, besides the title, since we said that, listening to music, I am so much interested with interacting with children. So be it in a matatu, in a church setting, anywhere, you'll find me interacting with children if they're around. Basically, that's Lewis.
How did you get yourself into being a child psychologist?
So it's a very interesting story. Just to take you back, when I was doing counseling psychology, so I did my practicum at PCA Kikuyu Hospital. I didn't have any expectations, but I had that setting because in class you are taught by the lecturer that the setting will be this way, there'll be 2 seats and the client will be on the other side. So that's what I expected. So when I went to the hospital setting, it was all different. So I had to go to male ward, female ward, maternity, somewhere I didn't even think I will enter. So I went to basically all the departments in the hospital. Now, there was a case that I handled of an older woman who had diabetes and their right foot had an infection. The foot had to be amputated above the knee. The surgery needed to be done above the knee. Now I had to prepare them for the surgery so that now they can come into terms. Now, since it is a lifetime adjustment, you need to prepare them.
Yes.
Now I prepared the older woman, then she accepted to proceed with the surgery. Now, before the surgery was done, then the infection now spread to the whole foot. Now the amputation needed to be done now from the hip. Now the whole foot had to be removed. Now I had to go back to the ward, try and counsel and convince the woman so that the foot can be removed, because the surgeons had already suggested that if the foot won't be amputated, the infection now will spread to the major organs, which will really be bad. Now, the woman refused completely for her foot to be amputated. So I had no choice. So I called in the relatives, had a family session with them. They talked to the patient, and the patient reluctantly refused to do the surgery. Now, at the end is now when she was unconscious and she was now referred to KNH. But before she got to KNH, she passed away. So I think that day was the lowest for me when it comes to counseling. I think that's the main case that I've handled that was really heavy on me.
Oh no.
Now that day, I decided to pack all my things. I didn't even tell my supervisor. Then I went back home.
Oh my goodness. But yeah, given that you were just out of campus and then that is the first major case you're dealing
Wow.
with, it's a lot.
It was really deep. So I really thought I went home. I really cried. So I asked God, what? I didn't sign up for this. And we were not taught this in class, actually, to handle cases like this, grief like this, a life adjustment. How do you even tell someone that they are going to lose their whole limb? And it's already a mother of 3 who has younger children. She has to fend for them. She has to provide, she has to care for the husband. There are a lot of logistics when it comes to that particular counseling. Now, I decided I'll do all the counseling. Now, since in the hospital, you are not limited, so you're supposed to counsel everybody.
Yeah.
Now, I went in the next day, but I was still shaken.
Oh, at least you went back.
Yes, I decided to
At
go
least
back.
you went back.
And now I decided now to take a different approach. So I was open to each and every patient. So be it the elderly, the young ones, the mothers, and now the men. So I counseled everybody, and I noticed that I was more inclined to mothers, and mothers, especially those who had children. If the child had come in and they had pneumonia or something, I was more inclined to them, because most of the time I will spend much time in those wards as compared to the other ones. So with time, I got to realize that I have a passion. Then something that made me to study child psychology will be my background as a child. So as a child, I went through bedwetting. That's why I usually do a lot of webinars in regards to bedwetting, so that I can give a voice to those children who in that time you usually have a lot of shame, a lot of guilt, and you don't have someone to speak for you. Most of the time there's a lot of stigma. So as for me, I went through all that. Then I also went through, can I say, childhood trauma, because a lot of time in my childhood I was alone. So there's an age gap between me and my siblings, a 10-year age gap.
Okay.
Yes, I'm the firstborn. So at that time, my parents were both working. So the only person that was left with me were, I think at the moment they're called house managers. Now the house managers are the ones who used to terrorize me, threaten me, now deny me food. I can remember even there's a time that the house manager decided to put a cockroach in my lunchbox. So when I opened in school, I found that there isn't bread, there isn't cake, there was only a cockroach.
No way. Like they didn't put food, they just put cockroach?
Yes.
Okay.
But eventually I decided to tell my mom, and the arrangement was now different, because now I was coming home from school. Then I used to go to my grandmother's place. Then my mom now will take me now from there in the evening. Then we come back home. But it was really bad, really bad.
That's between what ages for you?
From 2 years to, I was in class 3. A class 3 child is supposed to be 9-10 years about. Now from 3 years to 10 years. So
At what point did you stop bedwetting?
When I went to class 2, that's when it stopped.
Okay. So from your experience after background of your traumatic childhood and now with your experience and expertise, how can someone who has a child who's bedwetting best support them in navigating that life?
Yes, there's something that the parent and the community I usually talk about the environments of the child, because children have different environments. So to start with their peers, it can be at home or in school. Now that environment with their age mates. The other environment is at school. The other one is at home, and probably the other one is now with the extended family, or now with the parents and the siblings. So you need to look at all those environments. Now, when you look at each one of them, you also need to equip each one of them with information. So basically psychoeducating them, because most of the time usually we don't talk about bedwetting, because we know bedwetting is something that is not supposed to be talked about in this African culture.
Yep.
So if someone is bedwetting, so be it an adolescent, an adult, or a child, most of the time it is usually stigmatized, because you are usually pushed away. You are told that you are different now from the others. Because when it comes to the sleeping arrangement, what needs to be done is first of all communication, because communication is usually made to be bad, because there are some words that you say to that child that they will never forget. Because for me, I can remember there are some words that I was told, and till now can be able to tell you that they weren't good. So in terms of communication, you need to be empathetic with them and validate their feeling. And also the other thing is now getting feedback, because also they are at risk of getting depression, getting anxiety, withdrawing themselves, because most of the time if you tell them that you wet the bed and the way you are big, those big words that African people use. So basically you need to get feedback from them, ask them how are you faring on, if there is something you can give them, and also like psychoeducation on enuresis alarm. So there's usually an alarm for bedwetting that really helps as compared to having an alarm. For the bedwetting alarm, it's a little bit different, because it's like a round thing that usually has some wires. There's a part that usually put in your underpants, and the other one usually put it on your arm. Now, the essence of that part that is usually in the arm, it usually vibrates, and also the other part that usually put on the underpants usually vibrates. So whenever the bedwetting machine detects any drops of the urine, it will now be able to alert you. It will vibrate, and it will also produce some light. Now it depends with children who normally sleep with the lights on or off. Now it will produce some light, and also it will vibrate. So it has a really loud noise that will now make the child or the adolescent or the adult to wake up and go and relieve themselves in the washroom. Now, as
I didn't
compared
know there was a bedwetting alarm.
Yes, it's called the enuresis alarm.
Enuresis alarm.
Yes.
Interesting. I'm just thinking, because by the time children are potty trained, and as you said, the environment is very key to how they develop. At what point should a parent be concerned that imeendelea sana, we need to find a solution, or is it just open?
Ideally for children, by the age of 2 years and a half, they are supposed to have known in terms of potty training, taking themselves to the washroom, relieving themselves. So now when it goes overboard and they wet the bed most of the nights, you can now take it as an alarming. So you can talk to them, because for bedwetting, it usually has different causes, and each and every child is unique in their own way. So bullying can be taking place in school. That's why they are bedwetting. So when you resolve that issue, the bedwetting goes away. So you can look at home. So if the siblings, they're having sibling rivalry, they are fighting, they're not sharing something, you will find that when you speak to them, the bedwetting will now go away. So you need to find the cause of the bedwetting so that you can be able now to put it on hold. If you explore all the environments and you find that the bedwetting is not going away, now you need to seek medical intervention. Because one, it can be their bladder is too small, it cannot be able to hold a lot of urine. So when the urine is stored in the bladder, it now comes out. Then the other thing, it can be a fistula in the bladder, so a hole. So that's why the urine is now coming out. So you need also to seek the medical advice.
Yeah. Wow. I've learned a lot. Okay, but let's just go on the broader scale of children's mental health. What are some of the common mental health challenges that when you deal with children, you see them experiencing or going through today?
So one, we start with anxiety. Children also get anxiety, so they're anxious, just like adults. The other one will be depression. Also, children are also depressed. The other one will be selective mutism. So we find that a child is silent probably to specific people or silent in specific environment. The other one common is ADHD, so the attention deficit hyperactivity disorder.
Yes.
We also have autism. We also have PTSD, post-traumatic stress disorder, and not forgetting childhood trauma. Another one I'm forgetting is dyscalculia, the difficulty in math problems. We also have dyslexia. We also have dysgraphia when it comes to the handwriting. I think those are the most common disorder. Now, besides the extreme, I think I've also interacted with a child who had psychopathic tendencies. So even children, it usually starts when they are a child. When you call an adult a psychopath, it means that it has started in their childhood and it wasn't identified. So the child was a 7-year-old. So the child came in with the traits of ADHD. So they were not able to sit still. In school, there was a lot of disruptions, no concentration. The hyperness was there back at home and in school. The child also had conduct disorder because the child had caused some injuries to his fellow pupils. So what the boy had done, alikuwa amechukua kiti, then he had hit the other child with a seat. So even the other child had been hospitalized because of that. Then at home, the things that he was doing, so he had tried, I don't know if you have ever tried as a child to light up a tissue paper. So for a tissue paper, it usually
I did that.
it usually lights up really easily. Now for him, what he decided, he took a new roll of tissue paper, then akaizungusha kwa nyumba, in the sitting room, in the kitchen. Then he ended up the last place was in the washroom. So he took a matchbox and lighted it up. So for a tissue paper, it goes now round. It lights up really easily. So the only good thing that happened is that the house girl got in the house immediately that time he light it up, because the house could have gotten fire. Then he had also tried to choke the little sister with a carrot, literally choking. So taking the carrot and putting inside the mouth of the little sister. He had also taken a knife and tried to cut the house girl with a knife. So probably those were the traits. And also he had killed a cat. I don't know how he managed to kill a cat. I was even shocked.
Wow.
Because the parents had videos. He had taken a cat and literally slaughtered the cat. And you usually see that cats have 9 lives. I don't know what happened.
Oh, yeah.
To the other 8.
You're not serious. My goodness. That's wow. So in that instance, is it because that they are genetically inclined to exhibit psychopathy, or how does that come about?
So now it usually depends with the personality of that child and also the environment. Now, a backstory of what happened to the child is that the parents had separated. The real parents had separated, and now the boy was staying with the stepmom. Now the stepmom came in with another child. Now this boy was jealous, so he didn't want anything to do with the stepmom, anything to do with the other sibling, because he was feeling like the attention was being stolen from him. So he had to do anything so that now he can restore the environment that was there before. Also, the parents were extremely busy. So you see, they don't have any time. So the only person who is interacting with this child is only the house girl. So even in terms of monitoring the behavior, it's not there. So he does whatever he wants. And he's the child that if he wants something, you must give him. And the parents, they had money. So they used to provide for him everything. So if it is gadgets, he had all of them. If it's the material things, he was being given. So you can see even in terms of parenting, in terms of that behavior modification, it's not there. He is at liberty of doing everything he wants. And also when it was reported in school, the stepmom and the dad, they denied it. So you see, it gave him a leeway for him to get away with it, because he so can even do something else and they'll be at my back.
What happened to him eventually? How was he treated?
So what happened, he was expelled in school because I did an assessment, and he had, in terms of ADHD, he had the severe level. signs of ADHD because he could not be able to sit still, he wouldn't do anything. So actually he was started on a medication, but now the problem is he was shifted to a lot of facilities because I was the first the first child psychologist I saw him. After making that diagnosis, and I told the stepmom and the dad that he has psychopathic tendencies, he has a conduct disorder, and he has ADHD, and he needs to be put on medication. They got angry and decided to look for another facility, just like patients do in hospitals, to seek for a second opinion. So they decided to go to KNH. So ideally, because people know that KNH has good doctors. Now they still went, and they were given the same response exactly just like I wrote, because they even asked a letter from me so that now they can take to the other psychologist. They even took him to a child psychiatrist. I don't know if Dr. Omondi.
No.
So Dr. Omondi is a child psychiatrist at KNH. Now Dr. Omondi still gave the same diagnosis that I gave. They weren't satisfied with Dr. Omondi, so they went to Gertrude Children's Hospital for another assessment. So they went to Gertrude, and the same diagnosis was still made. Eventually, they didn't come back, but I've been asking about feedback, and they told me that he was expelled. When I was doing now the diagnosis, I went for the school visit so that I can psychoeducate at least the class teacher, the main stakeholders like the head teacher and the deputy, so that they can be able to know. So they were really angry because they were saying that his grades are really low, he's causing a lot of fuss in school. So they decided to let him go. So at the moment, I'm not sure which school he went to, but now I am really scared because now the parents didn't get to deal with the psychopathic part, because now that's still going to continue. He might mask it for now as he's growing up, but eventually it will still come up.
Yeah. And that's actually what I was thinking, because then if it's not dealt with when he's younger, but then again, I'm also questioning, how can it be dealt with when he's younger? Because can you really change him or give him medication that will help the psychopathic tendencies to dial down?
I think for him, it will be best if he will be put on medication in regards to ADHD, so that in terms of the attention deficit and the hyperactivity, it can now be toned down. Now, when it comes to the conduct disorder, since now that's the icing on the cake, it can now be modified. There are those special schools that usually incorporate children who have conduct disorder, ADHD, so he can now be trained when he is in that specific school. So that...
Do we have those schools in Kenya?
Yes, there is. So there's a school that usually incorporates children with ADHD and also autism. So because for him, he has like a series of diagnoses, so for him it will be even much better, because now they will be dealing with the ADHD and now together with the conduct disorder, because now at least now they will monitor him 24/7. When he wants to do something bad, he'll be told, you're supposed to do this and this, because now they'll be 24/7 monitoring, now as compared when he goes back home and nothing is now being done, because now he'll mask it, and whenever he decides to do something, it will be really bad. I don't know if you saw that story of Warunge, the one who killed the parents, everybody, because he watched
I remember.
the series of Killing Eve. So even for him, if you do a really good follow-up, you will see that it started when he was a child and he masked it, and now it came out when he was older now.
Goodness.
Those children usually say that huyu anakuanga tu mbaya, huyu hataibadilika, huyu tabia yake inakuanga hivyo. You see, you have already labeled them. So you see, even for them, they even accept it, because you are not the only one saying. If you tell a friend, the whole community now will label, say huyu hajai kuwa mzuri hadi akiwa mdogo. So even if they do something outrageous when they're an adult, it won't even be a shock. Yes.
And speaking of personalities, how then can a parent know a normal child versus a child who's either experiencing a mental health concern or they're emotionally unwell? Because when you mention a personality, we have the introverts who are quiet and they're reserved, and then you'll be like, they were just silent. So how can the parents know the difference? Oh, this is them, but then this one is not okay.
Let me start with for mothers, since mothers have that motherly instincts. So it is good to really feel it and listen to it really keenly, because most of the time it doesn't lie to you. Because I can say, I won't speak for fathers because it's different.
Okay.
So for mothers, they know how something is wrong in terms of their child's behavior because they have been able to monitor. Like the time a mother is breastfeeding their child, so there's usually that emotional connection, that connection with you and the child. So you're able to know and monitor as now they grow up. So one thing in terms of personality that can tell you my child something is not going good is in terms of the feedback that you get from the other siblings to start with. So if the other siblings start complaining and telling you that, mom, John is doing this and we are not happy, this and this, you also need to take account of it. If I am to give an age when personality usually forms in a child, it's between the ages of 4 to 12. That's when they usually now form their personality as a person. Because at that point, they're able to comprehend different things like grief, loving someone, losing someone, happiness, crying. So they're able to comprehend a lot of things in terms of their emotions, their feelings, the environment. Auntie has gone, mom has gone for some time, and mom is coming back. So they're grasping a lot of things. So even their personality is now forming. Now, another thing that you can be able to look at when you're looking at personality as a parent will be the interaction in the different environments. So if your child loves to interact with other children, you need also to monitor them so that you can see if they lose, how do they react? Do they get angry? Do they smash the toys? Do they go away and say that the game is over? Also, you also need to look at when my child, probably if my child loves to play alone, why is it that they play alone? So you need to ask them, is it that they are scared of other children, or they are scared of judgment? So you also need to get feedback, because that's the only way that you know the personality of your child. They tell you that I am okay playing alone. If I go and play with this one, they'll react this way. You already know that they are now scared of judgment, of the interactions. So you'll be able to know, this is what I need to do. This is how I'm supposed to do them. So basically, it relies on a lot of observation and also feedback from different people. So it can be a parent, a neighbor, or another child. That's the only way that you can be able to know the personality of your child. And now you can now put in measures of how you can try and form a healthier one. Because now, like you talked about introvert children, probably if there are children who like to stay alone, do this, you can do an experiment or bring in children for them and see how they react. So if they won't engage, you can now let them play on their own.
I
Yes.
hear you. You mentioned that children suffer from anxiety and depression a lot. Apart from because we perceive things depending on where we are. So as adults, you're like, how do I present myself when I'm anxious? So how does a child present themselves when they're anxious? But what are some of the signs that are mostly missed apart from the common ones? And I'm putting quotation marks on the common ones because they're not really common.
To start with, we start with the unique ones, something that can tell you that my child is really anxious. So we start with the most common and funny one. So when you're preparing a child to go to school. So when you wake up a child and you tell them that they need to prepare for school and they don't wake up, their uniform is there, they don't want to wear. So that one shows you that they're either anxious or something is happening in school. So if a child you are preparing for school and they're really anxious, if they're used to be doing their things in a certain way, they wake up, they have a shower, they wear their uniform, they take breakfast, then they wait for the school bus. So that they wake up early, they don't want to wear the uniform, they haven't taken their breakfast, they're really late. So it shows you that particular child is anxious about something. So you also need to be able to get feedback and ask them, is it the class teacher? Is it the students in the bus? Is it in class? What is really happening? Then the other thing will be tantrums. So children with the tantrums in the morning, so it is not normal.
Oh, it
Actually,
isn't?
yeah?
I thought all children have tantrums in the
Not all
morning.
children have tantrums. They are really good children who really they have already grasped the routine. So whenever you tap them or wake them up, they already know whatever they're supposed to do. So they wear their uniform, they take breakfast, they pack their homework in their bags, then they wait for the school bus. For those who the school is much nearer, they go to school. So there are those children who don't have tantrums. So they actually already know their routine. So what happens for those children who don't have tantrums is that their parents have already prepared they have already prepared them well. So in terms of validating them, in terms of telling them what they're supposed to do, if they need help, they ask for help. But basically is when the parent is cooperative with the child. So if you're not cooperative with your child, or you have disagreement, or you are a busy parent who usually leave all the work to the house girl does everything, and you as a parent usually like take the child to school, that's the only thing, you'll have limited time to bond with that particular child. So the only person who will be close with that child is girl, and not you as the parent. That's why most of the time you'll see that these house girls are stealing that attention, that love away from you as the parent, and that's not the truth. It's because for them they are taking some extra time with this child, because in terms of feedback when they come home from school. Then another thing, if you don't want your child to be anxious in terms of the school environment of that morning period, you need to prepare them the night before school. So ask them feedback. How was this subject? How do you feel about this teacher who teaches you math? What will you want to change? Yes, so that whenever even they go to school, they feel that my parents are also part of my education.
Okay.
So if your child is having tantrums in the morning, that is a clear sign that they're anxious about school and they don't want it.
What if it happens any other time of the day? If it's over the weekends and they're not in school, but they're still having it, is that an indicator for something to be concerned about?
Now it depends with when the tantrums, because I understand they can't wake up and start with tantrums, so it means that something has already happened.
Could be.
But if they have woken up and they still have tantrums, you also need to get feedback, because majority of the parents, when a child starts their tantrums, they'll tell them that unanisumbua, nitakutuma boarding, you won't be staying here at home, you're causing a lot of fuss, unanipigia kelele, the house is noisy, so you need to keep quiet. Even some parents go to an extent of telling their children to shut up. What you need to do so that now you can cope with this now tantrum, so that now they can be much few, is now acting in a more polite way, asking them what is wrong, because there must be a reason why they're having those tantrums. If they're sleeping with their siblings, something happened, they had a nightmare, they have just woken up, they're having tantrums, they want someone close to them, because tantrums are usually a sign that they want attention. It is just adults. There are those things that we usually do that will outwardly show that we need attention. Now for children, the tantrums are usually a sign that they need your attention as the adult, because most of the time children usually look up to adults. They do a lot of watching, so if you're doing something unpleasant, they'll actually copy it.
The adults do a lot of modeling to them.
Yes, a lot.
How does a parent know when their child is traumatized? As you've mentioned, most of the parents leave their children at home, and this is where the instances of they were molested, abused, emotionally, physically, mentally, without you knowing. Maybe they're not even exhibiting those other symptoms, but like, how can you tell that you might not even know exactly what it is, but are there telltale signs that a child is traumatized or they're experiencing trauma?
So one will be your child withdrawing themselves probably from the family. If you are eating or doing something, most of the time they'll choose to be alone. Even if they don't have their own room, they'll just sit in a corner. They won't like talk. So if it is a talkative child, you will find that suddenly they have turned to be silent. If it is a child who was completely silent, or probably they were introverted, they'll still be silent, but now there are those signs that you will be able to see. One will be they'll be really irritable. Now for those children who were silent and introverted, so they'll be really irritable. So probably if something happened, they'll really get angry, or probably even start crying really heavily in a way that will tell you that something is really wrong. Then the other thing is in terms of the academics, it will show you there's a traumatic thing happening. The academics will really be low. In terms of the appetite, they won't be eating well. They'll start losing their weight. Those are the most common things that you will see. Also the concentration in class, it will be noticed by the class teacher, so they'll be able now to tell you. Also at home, if they're watching something, you will find that they're daydreaming, or they're thinking deeply about something. That will show you that something traumatic has happened, and also a lot of nightmares. So if they're reporting, "Mom, I dreamt about monsters, this and this," you'll know that something is not right. And also for the older children, since we also talked about depression, Even trauma can also make a child to self-harm. In 2025, I've also seen like a 12-year-old and also an 11-year-old. They have also tried self-harm because most of the time they usually want to numb that pain because they already have that pain which is already going on. They're already depressed. So their parents have separated. The divorce, it hasn't been good. Life was good before, and right now they're struggling. They've been taken to a new school. The adjustment is so overwhelming. So they even now start self-harming with a razor. This has been happening a lot because I've seen several children with cases of self-harm.
What ages for most of them?
I've seen a 10-year-old, 11 and 12.
Oh, wow.
Yes.
So just pre-teen and just before they get to the teens.
Yes.
Okay. What does the healing process look like for a child if a parent is to take the child to therapy? What does that look like?
So a healing process for a child, it takes long than an adult because for children it's a little bit different even when it comes to the interventions that we use in therapy.
Okay.
Yes. Like basically for children you use play therapy, so that's where we use the play materials. Art therapy, so they can draw, paint. There's also sand therapy, they're interacting now with the sand. Because for children, for them, they need to understand probably what are the emotions, what is being irritable, what is being angry. When they're depressed, for them they don't know, but they just feel bad because for them they feel sad, they're withdrawn, they're crying, they're having these suicidal thoughts, they don't know what is happening because for them now you need to start from somewhere. So you need to hit them and tell them that feeling sad is this is what it means. Why are you crying in this moment? So you need to now associate it with something so that they can be able to understand, because for them you need now to go to the grass level before now you come to that level that you are using these interventions. And also gaining trust from them, because
That's a big one.
even gaining trust from them, it usually takes time. It's not like an adult. You'll ask them their name, you'll laugh a little, then they'll start telling you the story. For
True.
children it's difficult because each and every child is different, and children in this age, they are really intelligent. They can tell if you want some information from them, so you need to be tactful with them and gain that trust before you do anything else. Because if you haven't gained any trust, that child won't tell you anything. Trust you me.
Yeah.
They'll stay silent for that 1 hour. Then they'll go and tell their parents that psychologist was silent that whole time. Then he told me to open the door. Then we go home.
Goodness. Mzazi anaona umetumia pesa yake for no reason.
Yes. So it needs also to be practical, because for children, all counseling needs to be practical. So if you're telling them breathing exercises, you as the child psychologist, you need to do them, and they need to observe whatever you are doing. So if it is playing, you need to also play with them. So as you are playing, you are also now conversing with them, and they're telling you at home, this is now what happened. So for children, it takes a little bit time, but for them, the healing journey is usually good, because for them, after now, you now gain trust with them and you start the actual counseling and you use the intervention. For them, they usually heal completely, now as compared to adults who usually now relapse. Yes. Now for children, what you do now after the counseling, if you have 6 to 8 sessions with them, you now do a follow-up, so that now you can be able to know if they're using the interventions that you taught them and how their behavior is.
Yeah. As we wrap up, what are some of the rewarding moments of being a child psychologist, and what are the challenges?
Oh, rewards. Hey, rewards are you get a lot of gifts from children. Hey, children, whenever they heal or whenever you crack something, or you tell them that if they were having some bullying in school and you are doing the counseling and they eventually tell you as a slip of the tongue, hey, the next day they'll bring you endless gifts.
Oh, that is so nice. That is so nice.
The praises from the parents, but the most kindest, I think, will be receiving gifts from those children. Even there's a child who has ever prepared a poem, a song, just to tell you thank you.
Wow. Oh my goodness, that is so nice.
Yes.
Oh, okay, that is so fulfilling. What are your challenges?
The parents seeking second opinion whenever you make a diagnosis. diagnosis. Then the other thing is parents wanting, the overprotective parents, probably if a parent has come with their child and they need therapy, so that parent demands to be there, and you see now the child will not be able like to converse with you because they feel that their parent is there and it's an issue that is really sensitive. So when you tell that parent you need to step outside for some moment so that I can do my assessment or do this, they get angry. They tell you, you're not a professional, you're not supposed to be doing this is a child, I'm supposed to be here. I think those are the major challenges. The other one will be irritable children. You find those irritable children who will throw tantrums at you, will take toys, throw at you. As the child psychologist, you must know how to deal with that. And also, like the child that I handled, or the psychopath child. So for him, it was really a challenge because before I realized that there's a session that he took, there was a scissors which was in the play area. So I was really scared because alikuwa ameshika hivi. So those are the challenges if you get violent children who now might want to fight you back. Because
how did you handle it?
In that instant, what I did, I calmed the boy down and I told him to slowly put the scissors down. So I didn't panic, because if I showed any sign of panicking, now he would have done it.
Yeah. Have you watched the series Adolescence on Netflix?
No.
Oh, I invite you to consider watching it.
What does it entail?
It's about this teenage boy who, because of bullying, ends up killing one of his classmates. But then he goes through this session of therapy, and there was a time he had a really bad outburst when he was having a conversation with the therapist. And you could see the therapist was trying to control herself, but it was really getting out of hand. And then when eventually he left the room, she cried. But in the moment, she was very controlled. So I just remember that when you spoke about the scissors being pointed at you. Yeah, but I really appreciate your time, Lewis, and we'll definitely do this again. Is there anything you wanted to say, given what we've spoken about, that I may have not prompted with a question?
My parting shot will be, we should all be advocates of children, because most of the time there is no one to speak for children, because we all speak for adults, adolescents, and never for children. So the issues that we speak for children, that it's when it's really worse, when they have been sexually abused, physically abused, that's when we speak for children. But other than that, it's usually a lot of silence. When they bedwet, when they're failing in school, when their mood is all over the place, we are not talking about them, we are silent, we are just watching. So for those small things, we can look into them so that we can give voices to these children. Because if we don't mend these children as early as now, they'll become really irresponsible and they won't have a good mental well-being when they grow up, because they'll spend their whole lifetime in therapy. So parents should now start looking at the small things right now, so that now they can be able to raise responsible and mentally fit children and adults in the future.
Thank you for all the work you're doing with the children. You're really doing a good job, and we'll definitely have another conversation. Where can people find you, and how can people support you?
You can find me on LinkedIn, Lewis Karanja, on Instagram, Karanja Lewis, Facebook, Lewis Karanja. Yes, basically those are my social media handles.
Okay. This has been In Session with Jael Keya, the space where healing hearts connect. Hearts connect. Hearts connect.